Hello, everyone. Thank you for joining us today. My name is Alyssa Green. I'm the Outreach and Education Manager at Georgians for a Healthy Future that I'll call GHF today. We are hosting this event to celebrate the release of our Outnumbered report. And before I jump into that, I just want to talk a bit about GHF and our work. And so we are a health advocacy organization. We're based in downtown Atlanta, but we do work all around the state of Georgia. And so we really work to be the voice of Georgia's consumers as state leaders and policymakers work to make decisions that directly affect healthcare and health coverage for people around our state. And that kind of directly relates to our Outnumbered report. And this report really captures the results of the analysis of the public comments submitted about Governor Kemp's Medicaid waiver proposal, and we'll be diving into the specifics of that shortly. These public comments are a part of a really important legal process, and that really helps determine whether or not the waiver is approved by federal officials or not. And the comments are also an opportunity for Georgians to share their thoughts and perspectives on the Medicaid waivers and proposals. And so it was a lot of information that was really important for us to share. I want to, before we get into the actual report and what that all means, I kind of want to share some context about the process and about why that was important as well. If you could think back to last year, November of last year, that was when Governor Kemp announced the specifics of the Medicaid plan, which we'll call the Georgia Pathways to Coverage. And so included in that plan was a specific waiver that allows states to expand Medicaid in different ways. And the proposal that Kemp set forth would begin next year, whereas a full Medicaid expansion could be implemented immediately right now. And so I want to talk about some specific parts of the plan that we really spent a lot of time thinking about and sharing information about to folks around the state. The plan that the governor has set forth would expand Medicaid eligibility to adults in the state up to 100% of the federal poverty line, or FPL. And so for an individual, that's about $12,700 a year. And for a family of four, that's about $26,000. But there's some pretty strict requirements for enrollment that include work requirements. And so having folks prove that they are working at least 80 hours a week. And we have seen a lot of issues with reporting and a lot of issues with having that as a requirement for coverage. And so that's something that we felt was especially problematic, especially given the job loss seen in Georgia right now. There's also premiums and co-pays for enrollees who would make more than 50% FPL. So that cost sharing for one person could be up to $600 and will be up to $1,300 for a family of four. There's also no transportation benefit. So there is a program, non-emergency medical transportation, or NEMT, that allows folks to be transported to and from their non-emergency medical appointments. And we see that not having that as an added benefit would really affect people's access to their healthcare services. And that would definitely affect folks in rural Georgia, folks who have chronic illnesses, folks living with disabilities, who already face pretty stark barriers to care. And so I kind of want to close the context with saying that this proposal anticipates about 50,000 Georgians being able to gain coverage, and Georgia paying about 30% of those costs for the partial expansion. And that's compared to about 408,000 Georgians who would receive coverage with full Medicaid expansion, and with the state paying about 10% of the cost. So in short terms, that's covering fewer people for a lot more money versus covering more folks for less costs. So I kind of wanted to share that context before we really jumped into the report. I also want to talk about ways that folks who are watching today and folks who will get this message later on have an opportunity to really advocate for Medicaid expansion. I will say this a few times during the event, but if you head to coverga.org, we have templates set up for folks to contact the governor, you're able to tailor your response to talk about your personal perspective if you would like, and it really kind of streamlines the opportunity to really share your thoughts on Medicaid expansion and why you think that would be important for folks in Georgia. And I'll also share that this event will be recorded and we'll be sharing with you later on. So please look forward to that. With that all said, I'm going to introduce Laura Colbert, the Executive Director of Georgians for a Healthy Future, and have her jump into the report.
Yeah, thank you, Alyssa. We're really pleased to be with you all today, and also to be joined by Joan Alker with Georgetown University's Center on Children and Families to kind of provide some context to why the results of this report and why the comments submitted by many of you during the comment period are so important and so powerful, and also for all of us to talk about, why Medicaid expansion is the right move for Georgia right now. So to back up just a little bit, of course, Georgia is one of 14 states that has not yet expanded Medicaid. We know that 36 other states plus DC are really seeing a lot of benefits from expanded coverage, especially in the midst of this pandemic. Georgia instead has chosen to put forward a partial Medicaid expansion proposal, as it's sometimes called. And so Governor Kemp has used this 1115 Medicaid waiver mechanism to kind of propose this more conservative way of going about Medicaid expansion. When a state puts forward one of these plans, they're required to have 2 comment periods about the plan. One is at the state level and one is at the federal level. And so when Governor Kemp proposed his plan, and as Alyssa mentioned, that's called the Georgia Pathways Plan, these comment periods the state comment period ran from November 4th to December 3rd of last year, and the federal comment period ran from January 8th to February 7th of this year. Over the course of those comment periods, 2,700 Georgians submitted comments. That's amazing, and I believe that we have a fun graphic of all of those comments and the ratio of how many are for and how many were against the proposal that the governor put forward. So you guys will have to excuse me, I'm doing 17 things at once. As you can see here, the majority of commenters did not support the governor's proposal to partially expand Medicaid and to put in place all of those other barriers to coverage that Alyssa mentioned previously. Most of those who expressed that they did not support the plan instead expressed support for a full Medicaid expansion, as is envisioned by the Affordable Care Act. And then a very small proportion of commenters supported the governor's proposal, and really there were a number of commenters who didn't support or oppose, and those folks even outnumbered the commenters who supported the proposal. So I'm gonna just briefly go over kind of the state comment period results and the federal comment period results, but I want to spend most of my time really looking at the content of the comments, because we think that's maybe even more important than the numbers. So Michelle, if you want to take us to the state comment results, great. So as you can see here, there were 960 comments that were submitted through November in the state comment period. 88% of those comments opposed the governor's plan, and again, the vast majority of those commenters preferred a full Medicaid expansion. only 4% supported the governor's plan as it was written. And again, even those commenters were outnumbered by the 8% of commenters during the state comment period that were neither supportive or opposed to the proposal. Let's take a look at the federal period. And here you'll see that the results become even more lopsided. During the federal comment period, 92% of commenters were opposed to the proposal. And again, many and the vast majority of those supported a full Medicaid expansion. Only 29 commenters out of 1,812 comments supported the governor's proposal. And then 6% of commenters didn't express a clear position about support or opposition. And we have a detailed breakdown of kind of how we categorize the comments in the report, and you're welcome to take a look at that. Maybe we can post the link to the report in the comments to this video. But as I mentioned, maybe more important than the actual numbers in the report are the content of the comments. What we saw from our analysis, and I should shout out to our amazing health education and advocacy intern, Tyler Adams, who really led the review of these comments. She read every single one of them, and then our staff also read many of them. But the commenters really shared stories about their own need for coverage. They shared stories about loved ones who are in Georgia's coverage gap. There were a lot of stories from folks who already benefit from Medicaid and could really speak to how important it is for their lives and how it could benefit others that they know. The comments also painted a really compelling picture of how inadequate the governor's proposed plan is. Repeatedly, we saw stories that described how people would be left out, how Georgians would struggle to get or maintain coverage, and how inequities across race, geography, and health status would be maintained and in some cases exacerbated through this proposal. And I just want to share a couple of the quotes that I think really capture, kind of the sentiment that we heard. I don't want to read to this amazingly smart audience, many of you who submitted these comments yourselves, but at the risk of doing that, I am going to read a few. This first one is from a commenter who has experience with Medicaid coverage, and I think does a really good job of capturing many of the themes that we saw in the comments. They said, quote, "I have a severe disability that limits my ability to work. So I work part-time from home. Every extra bureaucratic step involved in getting the medications and the healthcare I need to function well directly lowers the number of hours I can work and engage with my community. Delays in receiving this care can impact me for weeks, months, or years, potentially resulting in a permanent loss of function. I want all of my neighbors and friends and family to be able to access the care they need to live fulfilling lives, instead of opting for the governor's expensive Medicaid waiver that will leave hundreds of thousands of Georgians uninsured. Please expand Medicaid coverage instead. Georgians want everyone who needs healthcare to get coverage, not to institute needless and complicated barriers to care. Our generosity in caring for each other is what will make our state great." And that's the end of this person's particular quote. That last sentence is especially touching given the context of COVID-19 right now. We also heard from a lot of caretakers during the comment period, or people who were caretaking or are currently caretakers. And we got some really great stories and moving narratives from people like that. And I want to share one of those as well. Quote, my fiance is a full-time caretaker of her mom with stage 4 cancer. This waiver has burdensome work requirements. Under this waiver, my fiance would not be eligible for Medicaid. She does not have the time to volunteer or work 20 hours per week, and she certainly does not have time to report those work hours through our completely defunct state Medicaid management website, end quote. And we heard from a lot of folks like that who are really, caretaking either for children or for adults who need caretaking in their lives, parents or otherwise. And then, another of the themes we saw is captured here. You can see it on your screen, and it really touches on the issue of racial disparities. And, COVID-19 has really highlighted how disparities between races in the US impacts health outcomes, and there is clearly a direct correlation. And commenters, even before this pandemic, brought this up as an important dynamic and commented on it during the comment period. So I won't read it to you because we have this lovely graphic. So you can see here that this person has really highlighted that as something that's important to consider in the state's proposal for coverage. And then I want to touch on one last theme that we saw, and that's really about the frustration people expressed about the cost of Governor Kemp's plan when compared to a full Medicaid expansion. And as Alyssa mentioned at the top of this event, the Governor Kemp's plan, the state will pay for 30% of the cost of the plan. And under a full Medicaid expansion, Georgia would pay only 10% of those costs. And so we saw a number of commenters that really express frustration about why we would cover fewer, why the state would cover fewer people and pay more to do that, as opposed to covering more people and paying less to do that, which seems like the better deal, and is the better deal, as we know from many other states and their experiences with Medicaid expansions. So again, I won't read you this quote because we have this lovely graphic, but this was not the only person who commented on it, and that was something we saw come up among a number of commenters. And I'll just close my comments with, collectively, Georgia commenters were very clear that Governor Kemp's plan falls short in extending coverage to low-income Georgians. The plan largely ignores kind of the lived realities and experiences of individuals and families across the state, and it doesn't make good use of state resources by giving up that enhanced funding mechanism that the Affordable Care Act provides to states for a Medicaid expansion. And these were all points that commenters made, and we saw them reflected kind of across the board. And so at this, I think I'll close out my comments and turn it back to Alyssa, and we'll go from there.
Thank you so much. We are going to be collecting questions, so please feel free to send those through our live portal right now. I do want to continue the conversation following up of Laura's remarks and invite Joan Alker of Georgetown University to speak about the implications of the comments and the analysis results and a bit more about what this means for folks in our state.
Sure. Thanks, Alyssa and Laura. It's great to be with you all today. So let me start out by just saying a few things about the public comment process itself. And this is a terrific report and really important that you guys have compiled this information. As Laura mentioned, the federal law requires that there's both a state public comment process and a federal public comment process. And currently the waiver itself has gone through those processes. It is pending with the Trump administration. There's no indication that they're going to act on it soon. They have been processing an enormous amount of emergency waiver requests related to the current pandemic. And I think a lot of their other sort of regular business has dramatically slowed down. So I don't think we're going to see an imminent decision on this. And I'll come back to the waiver's future in a minute. But just with respect to the public comment process, it's so important that all of you did comment, and that's really for a couple of reasons. First of all, your comments form the basis for the administrative record. And that is supposed to be the record that both your governor, who I believe ignored many of these comments while submitting the waiver, and I will say he's not alone in that. Unfortunately, that does happen with some amount of regularity. Most of these, certainly all of the waivers that I have seen, that I've been following very closely, the work reporting requirement waivers are very unpopular. I'll just give an example. In 2018, Mississippi filed such a request, and there were 320 comments, and 319 of them were opposed to it. So They went ahead to file the waiver anyway. So that is not uncommon. But the administrative record is very important because that forms the basis of the Secretary's decision whether or not to approve a Section 1115 waiver. And a Section 1115 waiver in the law is a research and demonstration waiver. It is not just, make something up and send it to me and I'll think about it. It is based in the statute, and the congressional intent was to use it as an opportunity to test out new concepts in the Medicaid program. And we have seen in about 5 states now, I think, where work requirements have been approved in a waiver that they've been challenged through litigation. And the Secretary's decision has been deemed arbitrary and capricious. And those waivers have all been struck down essentially by the court. And the court is making its decision on the administrative record, on the data and the evidence that is brought to bear in the administrative record, because this is not, the court is not looking at each state's proposal and suing the governor. The plaintiffs are suing the federal government for not following the Administrative Procedures Act. So I'm not a lawyer, so it's probably a little sketchy for me to be going in this area, but the point is, the Secretary of Health and Human Services, Secretary Azar, is supposed to make a decision based on reasoned decision-making with the body of evidence that he has in front of him. And that body of evidence includes, very importantly, these public comments. So that is essential, and the public comments have been cited by the judge routinely in his decisions. And I would just note that before the pandemic, right before, I forget exactly when it was now, but the appeals court upheld the judge's ruling 3-0. It was a very strong decision, and all of those waivers are on hold. So from a sort of national perspective, from my perspective, this waiver is on a path to nowhere. Because even if it does get approved, it will no doubt be challenged in court and likely meet a similar fate. Again, I'm not a lawyer, but if the governor wants to provide coverage to Georgians, which only seems more urgent to me now, given the pandemic, this is not the path to take. This will, as I say, I think it's on a path to nowhere. The second issue to bear in mind is that we have an election coming up. And this November, it's possible that we will have a new administration. And if we have a new administration, we will have a new Secretary of Health and Human Services early next year. And that new Secretary will again be looking at the administrative records of existing waivers, of pending waiver requests to render his or her decision. So these comments will remain part of that administrative record in the event of administration change. So that is important as well. So I have more I could say, and I do want to say about expansion in general, but let me stop there. And just the final thing I want to make is that note is this public comment process itself is actually part of the Affordable Care Act. It was something that for years and years, many of us tried to work on to get public notice and comment procedures, because these waivers are so important and a lot of times they be negotiated behind closed doors. So when you hear that there are efforts by the Trump administration and a number of attorneys general to strike down the law, which is in pending litigation, as we all know, this comment process is one of those little things in the hundreds of pages of the bill that would go away. So just wanted to mention that. So Alyssa, back to you.
Thank you so much for those remarks. I really appreciate hearing more from your perspective. It seems like we do have some questions, so I'm going to go ahead and pose a quick question. So it seems like the first one we have is about the financial aspect of Medicaid expansion. So can we explain more about why the state would pay 30% versus 10% for partial and full expansion? Can we kind of put a little more context around that?
Yeah, I'll kick that off, and Joan, please jump in at any point. So in every state, the Medicaid program is a jointly shared program between the state government and the federal government. And as part of that, each state pays a portion of their Medicaid for a portion of the Medicaid program. But the state or the federal government picks up the majority of that. In Georgia, our split is about 2/3 being paid by the federal government and a third being paid by Georgia. So we're right at, I think, 33% is our what they call an FMAP. I cannot remember what those letters stand for, but essentially we pay 33% of our Medicaid program, which I've rounded to 30% for simplicity in my comments. Through the Affordable Care Act, one of the provisions, and in the hundreds of pages that Joan referenced, is that when states expand Medicaid coverage to low-income adults who are not covered through traditional Medicaid populations, and those traditional Medicaid populations are typically children, people with disabilities, pregnant women, and very low-income parents. If a person doesn't fit in those populations, and they're a low-income adult, and their state chooses to expand Medicaid, the Affordable Care Act said the federal government is actually going to pay 90% of the costs, and the state will only have to pay 10% of the costs of that new group. So Georgia would continue to pay 33% for traditional Medicaid groups, but only 10% for this new group. So it can be a little complicated, and there's lots of money and fractions in there, but essentially this is a really good deal that the Affordable Care Act got built into that was built into the Affordable Care Act law.
Perfect.
Yeah, and I'll just add two things to that. One is that it's very clear that Georgia, no state is going to get that 90% match for a partial expansion that just goes to the poverty level. This is an issue that had been pending as a request from a handful of states, Massachusetts and Utah, and the Trump administration has said no. So that's not going to happen. So if this waiver were to be approved, as I mentioned, it would face many, many other hurdles, including litigation and other issues. But the Trump administration itself has been very clear that they would not give you what that is called the enhanced match. So the state, instead of paying 10 cents on the dollar, would be paying 33 cents on the dollar. And that's fiscally foolish. That's one of the many reasons this waiver is really terrible policy. It's fiscally irresponsible. It doesn't provide coverage to very many people either. So I did want to mention, of course, state budgets are facing enormous challenges right now, and that's particularly true with the pandemic, and Medicaid is really in the eye of the storm here, right? They're both on the health side and the consequence of so many millions of people becoming unemployed. Medicaid is really in the eye of the storm. So we face some really serious challenges. But for a state like Georgia, this would be potentially a huge infusion of federal funds to pick up the Medicaid expansion, which you could do very quickly through a state plan amendment without going through all this complicated waiver process. And even though the state has to pay 10 cents on the dollar, which first of all is a great return, right? If you or I were offered an investment and you could get paid 10 cents and you can get back 90 cents, you'd say, "Whoa, that's pretty good." But states have found, and there was just a new study I want to talk about, that it in fact is really costing them basically nothing because they're able to find savings in other areas of their budget because they are paying for the uncompensated care. These people are still there. They're just uninsured, and they do show up in the emergency room. They're going to show up in the hospital if they get COVID. And there are costs there, and somebody has to pay them. They get shifted to other payers. And there was a recent study, and I think it came out on March 31st of this year, so right when we were all sort of in the grips of shutting down the pandemic. I think it got lost. But some very eminent health economists have a short piece in the New England Journal of Medicine, and they looked at the budget data for all states between 2010 and 2018 when expansion was implemented in 2014. And what they found was that, of course, there was an increase in Medicaid expenditures because a lot of these federal funds are coming in. But they say, and I'm just going to read their finding, we found that this increase in Medicaid spending was subsidized entirely by increased federal funding to expansion states, with no significant changes in spending from state revenues associated with Medicaid expansion. So that is a really important finding that's consistent with other reports, but this is a very new report. Again, looking at a lot of data and finding that this will not have a negative impact on the state's budget. And in fact, from an economic perspective, it will have a very positive effect on the state's economy, because you will have those hundreds of millions, and Laura probably knows the number, Alyssa, of how much is likely to come in. That money is going to be stimulating your economy, providing incredible support. Right now, we know a lot of healthcare workers are being laid off. So this could be an extremely important source of revenue for Georgia right now. Not to mention that people would get covered, and we have more and more people becoming uninsured every day, which of course is the most important thing.
Yeah, I'll just tag on. Georgia forgoes about $3 billion a year in federal funding for every year that we do not expand Medicaid. So again, that 9-to-1 match is really powerful and could bring in $3 billion in federal funds each year.
Thank you so much, both of you. We do have another question from our audience today. It looks like someone is struggling to understand how Governor Kemp's plan has advanced as it has, despite overwhelming opposition. And so, Joan, I want maybe you can speak to what happens if Governor Kemp pursues a partial expansion, even when comments are showing a really strong preference for full expansion, and what that might mean.
Right. So, as I said, unfortunately, it's not uncommon that governors have been submitting waiver requests, even though they are very unpopular at the state level. And there's really no good fiscal or health reason to pursue this proposal. But as we know, right now, this proposal is pending, okay? And so it's in the lap of the Trump administration to decide if they want to say yes or no, or yes to some of it and no to other parts of it. As I said, I don't think any decision is imminent, because the Trump administration is swamped with all kinds of emergency requests. The Department of Health and Human Services, the folks that process waivers, we have all kinds of emergency waivers related to the pandemic. So this waiver is sitting there. It's waiting for a decision. I don't think there's going to be a decision anytime soon. But let's just say, for the sake of argument, that a few months down the road, the Trump administration says yes to some or all of this. Presumably, the state would then move ahead towards implementation. Another wild card, of course, is the election this fall, because if we have a new administration, I'm confident that this waiver, if it had been approved, would be revisited. And secondly, I think the chances that there will be litigation are extremely high. And so that would likely happen as things move forward, if the waiver was approved and moving towards implementation. So there are many, many wild cards here, and many, that's why I say I think this waiver is really on a road to nowhere right now. And it's certainly, given the crisis that we're in, it is extremely irresponsible, I believe, to continue going down this path when there is this health crisis, this economic crisis, and Medicaid expansion is the single clearest action a state like Georgia could take to have enormous beneficial consequences for both the health and the economic crisis the state is facing. I mean, there are only 14 states left who haven't done this. And those states have an easy choice in front of them. They can take the money, they can reduce their uninsured rate, they can stimulate their economy, they can support their healthcare providers during this pandemic. So, it's always been, the evidence is very compelling, and I'll just mention, the Kaiser Family Foundation does routinely a review of all the studies about Medicaid expansion, and I've never kind of observed an issue where the evidence just is piling up that this is a good thing to do, and that the research supports that. And the latest version of that lit review, they've now reviewed 404 studies. And 399 of them have found beneficial impacts of Medicaid expansions. So it's even more lopsided than your common analysis. The research is very clear. Medicaid expansion helps with access to needed care. It helps provide financial security to families who face medical bills, medical debt. It provides helpful impacts with respect to uncompensated care of your rural hospitals and other providers. There's just a long, long list of benefits, and the research is very clear. So this is not a question of policy. It's clearly an ideological issue. And at this point in time, with the crisis that we all are facing, it's just highly irresponsible not to pursue a regular Medicaid expansion, which could get moving very quickly if the governor decided to make that a priority. But this waiver is going to take months and months at best, and then it faces a very uncertain future, both because of the election and because of the litigation question.
Yeah, I'll just add on. I think Joan did a beautiful job answering that question. You know, even though Governor Kemp has submitted this waiver and it sits with federal officials, our state can expand Medicaid at any moment. We could set aside this waiver completely and go forward with expansion. We could expand fully while, you know, federal officials consider this waiver, but Medicaid expansion is not off the table. And I think that's why it's really important, as Alyssa said at the beginning of the event, to, you know, go to coveragea.org and email your elected officials. They are coming back to the state capitol in a few weeks to figure out how the state is going to respond to its financial crisis and to this pandemic. And they have the option to act when they are in that building or convening virtually, depending on what the new rules are. But they can act in the next few weeks to do this. And so it is an option that is actively on the table. And so we should ask our state leaders to pursue this option, since it is the responsible, moral, fiscally, you know, evidence-based option for Georgia.
Thank you so much for that feedback. Really appreciate it. It looks like there's another question about funding, what that might look like. So the question is there any concern from lawmakers right now that eventually the state will be completely responsible for funding if the federal government backs out at any point? Is there any kind of acknowledged concern there?
This is one of my favorite questions because I think it's easy to answer, and I think our state legislators have expressed that concern. All evidence points to the contrary. This 90-10 match, the enhanced funding match that we've talked about, is written into law in the Affordable Care Act. So in order to you know, change that funding mechanism, Congress would have to act. There has been no indication that they have an appetite for that. In addition, in past you know, recessions and crises that this country has faced, the federal government has increased federal funding to states for Medicaid, including in the Families First Act legislation that Congress passed in March. So, you know, we have seen all evidence point to the fact that the federal government backs Medicaid. It is an important tool for states, especially in recessions and in times where, you know, like the pandemic we're in now, and in public health crises.
I'll just add to that, you know, this is one of the many fact-free excuses I hear to not expand Medicaid. I can tell you the Medicaid program is, I think, 55 years old. They've never lowered the match rate, period, end of story. Never in the history of the program. And I can tell you, as somebody who's worked on Medicaid here in town for a long time and inside the Beltway, Medicaid is the biggest source of federal funding going to states. And if you want to mess with the Medicaid match rate, it is the biggest food fight Congress will ever have, okay? I don't care what party you're from, at the end of the day, you're there representing your state. And that's how everybody feels. And once you start messing around with the Medicaid match rate, It is a huge fight. This is one of the reasons the ACA repeal did not happen, because they were trying to block grant Medicaid. And I'm sorry to say, the ability of Congress right now to, to enter into such a complex and sensitive negotiation, it's not going to happen. It's simply not going to happen. It's never, ever happened that they've lowered the match rate. So I think that is really a red herring. And frankly, if Congress was considering that, okay, you tell your senators and representatives to tell them not to. That's what they're there for.
Brilliant. Thank you both for that. And before I kind of wind down today, I wanted to make sure we kind of honored the reality of where we are in our public health crisis. So I want maybe each of you to say just a few words about why Medicaid expansion is so important right now in the midst of the COVID-19 pandemic, and just maybe some implications that you feel are really important because of that.
Yeah, thank you, Alyssa. So I think there's some important facts about where we are now that are important to kind of keep in the front of our minds in this moment. First of all is that before the pandemic started, Georgia had the third highest uninsured rate in the country. Since then, Georgia now has one of the highest rates of uninsurance. And because of that, about 1.5 million Georgians have lost their job-based health coverage. For many of them, they will qualify for coverage through the Affordable Care Act. Thank God we haven't repealed it. And that it is still, here to act as a safety net for many Georgians. But in addition to that, about 1/3 of those Georgians are instead going to qualify for Medicaid. And so it's a really important safety net in a moment where there's a lot of upheaval in both our economic and our healthcare systems for the state. But those safety nets are not there for about 500,000 Georgians. So 500,000 Georgians do not have either of those options, despite being, hardworking and deserving and needing access to care in the midst of a pandemic. In addition, we of course have seen the racial and geographic disparities that this pandemic has brought to Georgia, but also across the country. And some of the studies that Joan mentioned earlier have shown that Medicaid expansion can help to close some of those disparities. Of course, they're not going to resolve all of it, but it helps to put Georgians in a different starting place so that those gaps aren't so big when things get really bad, like in the middle of this pandemic, or where we are now. I don't know that I said that super eloquently, but it's clear that Medicaid expansion is an important tool that Georgia has not taken advantage of yet, and that is an option that we can take up any day, and the facts on the ground demonstrate that there is no better first step that our state could take.
Yeah, and I'll just add to that, obviously I'm a research professor, and I go quickly to the research and the citations, and that's not new, right? We've had this research for a while. We know from a health policy perspective, it's absolutely the right thing to do from a fiscal perspective. And I think what the pandemic has really laid bare for me is the moral imperative. We have seen so clearly the racial disparities, the economic disparities of the way this pandemic has hit, the way that essential health workers and essential workers, folks who have to go out there and work every day, bus drivers, transit operators, all of those folks who are at increased risk. And with so many millions of people losing their jobs and their employer-sponsored coverage, Medicaid is a first responder, as I said up front. They're a first responder to the healthcare crisis. Medicaid is, the biggest payer of long-term care, for example, and not to mention providing insurance. And Medicaid is a responder to the economic crisis. a state like Georgia is tying one arm behind its back in responding to this pandemic by not picking up the Medicaid expansion because of Medicaid's role as a first responder. And I think we knew already about the health consequences, the economic consequences, but the pandemic has laid bare the urgency and the moral imperative with the kind of disparities that we are seeing that are shocking and just ripping our country apart. So I hope there will be a change of heart. And again, for a state like Georgia, one of the 14 that hasn't done it, this is the single quickest thing you can do to make things better in your state. So thank you again for allowing me to participate today, and congrats on a terrific report.
Well, I want to be the first to thank you, Joan, for sitting with us today and sharing your thoughts about the implications of what we found in our report. And I also want to thank Laura Colbert for sharing lots of feedback and perspective as well. And finally, again, want to appreciate our intern, Tyler Adams, who really led the analysis for this report and working with us, and also really thankful for everyone who was able to join us today. Before we close out, I want to remind folks of the opportunity to send messages directly to our governor, Governor Kemp, and really share your perspectives and feelings about Medicaid expansion. And you really have the opportunity to share thoughts and to really encourage Medicaid expansion for Georgians here in our state. I also want to remind folks that we will be sharing this event as we've recorded it today, and that'll be on our Facebook page sometime in the coming days for folks to revisit and hear the feedback once again. So I again want to thank everybody for joining us, and please feel free to contact us later on with any questions. And I hope everyone has a great day and continues to be healthy. Thank you.